Okay, so now we're going to demonstrate how to mix two insulins, okay? So the two insulins that we're going to mix will be the regular insulin. So if you guys need me to go over the different types of insulin, I would do that. But for the sake of this video, we're just mixing insulin. So regular, which is clear, okay? And you should know what type of insulin this is. Is it fast, short acting, intermediate, blah, blah, blah. So this is regular, and then we're going to mix NPH. You see how it's cloudy? Okay, so this is the intermediate acting insulin, all right? So we're gonna mix the two, all right? So these are brand new. I just, got them out the refrigerator. So if you got them out the refrigerator, you have to let them warm up to room temperature, okay? And once you open it, you have to label it for expiration. And when does insulin expire?
30 days.
30 days. Some facilities might do 28 days, 29 days, but if you remember 30 days, that's a good number. And you always want to put the date that it expires on here. And once you take them out the refrigerator, you label them. You always keep them at room temperature. You do not put them back in the refrigerator, okay? All right, so I need my insulin. I'm gonna need alcohol swab. Even though that I'm opening it for the first time, I still like to swab mine. And then you're gonna need your syringe, and you need an insulin syringe. And you have to look at what type of insulin that you have. If you can see, this is U100, right? So you wanna make sure that your syringe is a U100 syringe, okay? So if you can see on there, it says U100, right? And my insulin is U100, that's the concentration, okay? There's 100 units per milliliter in here, okay? And if you draw 1 milliliter, you'll have 100 units. So you don't want to get a syringe that's U500 because you will draw up 5 times the dose and you will kill your patients. And we are not in the business of demise, right? Okay, so we got our equipment and our gloves, right? So first thing we have to do is make sure that we have an order. Remember, everything that we're doing right now, we're in the med room. We're not in front of the patient. Okay, so we're in the med room. You want to identify that you have an order. You always have to check the order 3 times, right? So you're gonna check that there's an order for regular insulin, check that there's an order for NPH, and you're gonna check the route, the dosage, the frequency, when are you supposed to be giving it, if it's a sliding scale, whatever it might be, we're gonna make sure that the order matches up. And then, so you check the order, the doctor's order and the physician's orders against the MAR, the MAR, right? You check those 2. And then once you've done that, you take the medication against the MAR and you check it again, right? So even before you go get this, you check the doctor's order against the MAR. Verify there's an order. And then you go get your medicine and you check this against the MAR. That's the second time. And the third time we're gonna check our medication is at the bedside with the MAR with the patient, okay? So I'm gonna repeat that. First time you check the order, physician, order against the MAR, the medication administration record. And then you get the medication against the MAR. And then the third time is the MAR at the bedside with the patient, okay? So we got all of our checks and all that good stuff. We washed our hands. You don't have to put gloves on at this time. You just don't. You use the gloves when you're getting ready to inject. So I'm gonna take this off, brand new, like so, like that. All right, and because this is cloudy, you can see that the medication is settled at the bottom. So you have to gently rub it between your hands like this to mix up the medication. Okay, everybody got that? Just rub it, it's kind of soothing. Get that right. All right. Then I'm gonna get my syringe and open it up. Like so. So when we're looking at the syringe, this part right here, you can touch. The barrel inside, the plunger inside here, That's sterile, so you don't want to touch that, okay? No touching of that, guys, right? Make sure it's working. And I like to take my top off just to loosen it up. You know, I'm not going to take it all the way off. Just to loosen it up a little bit. And this one has the safety latch on it. And once you're done, you just pull it up and turn it and click it. And then it protects the needle so you don't stick yourself, okay? So our order says that we have to give 10 units of NPH. And we have to give 4 units of regular insulin. That's what our order says, okay? Our patient's blood glucose level was 270. So you never, never give insulin without knowing what the blood glucose level is. Always check that, guys, you know? Don't just blindly give that. I know sometimes the doctors might order that, but, you know, check the glucose level. Normally the doctor doesn't do that. You always have a glucose level. All right, so we're giving 4 units of regular, 10 units of NPH, right? So in order to get the medicine out of here, because this is a valve, we have to put air into here, right? And we have to put air into this one as well too. So the amount of air you put in here is the amount that you're going to draw out. So I said we got to have 4 units of regular. How much air do I put in here?
4 units.
Very good. So if I said we need 10 units out of here, how much air do I put in here?
10 units.
Very good. Now, we have to put air in the cloudy first, then put air in the regular. Then we draw up the regular, then we draw up the cloudy. Okay, air goes into the NPH, and then to the regular, then we draw up the regular, and then we draw up the NPH. Now, most of you guys are going to be going on to be RNs. If you're not, that's great because you're going to be amazing LPNs. It doesn't matter. A good way to remember that is you draw up the insulin from R to N. R to N. Okay, so you know you have to put the air in the NPH first. So, first thing I'm going to do is take my syringe, take 10 units of air. Okay? Take my needle off. You want to inspect that needle. Make sure it's nice and straight and all that good stuff. And before I do that, sorry. Look at me. That's my business. So then you want to just clean in a circular motion. Bam. Do that one too, just like that. Let it dry. Don't do none of this foolishness because, you know, you're spreading germs. Let it dry. Just give it a little minute. Got my 10 units of air, and I'm going to go directly in the middle. Boom. There's the air, like that. Look at me. Take it back up slowly. Now I'm going to do 4 units. And I just pulled that up. As long as I don't click it, it won't lock. Because I need to see this 4 units. You know what I'm saying? So, 4 units of air. Very good. Then we're going to go ahead and put it directly in the middle. Boom. Boom. All right? Now, we don't take this out. No ma'am, no ham. Now what we do is we flip this over and we draw up our insulin. So, I like to hold mine like that. You see how I'm holding it? Look at that. That's how I like to hold it. Just like that. See how I got my 2 fingers there like that? And it's stable. Like it's not going anywhere for me. Okay? Take my glasses out. Because I'm almost 50, so that's my business. I can't see that well. So, I can pull down as much as I want to. Here. Right? So I'm pulling down more because you can't have any bubbles. No bubbles. No bubbles. Bubbles is bad. You don't want to get bubbles to your patient. So then I want to push it back till I get to 4. Okay. I see you. Keep going. All right. Good job, Miss House. Good job. So pull that out. Like so, like that. Pull that up. Then there's a little bubble up there. I'm just going to pop it out. There we go. So, no bubbles. Now I got to go in here and get 10. Right? So, I already got 4 in here. I got to get 10 more. So, I got to draw it up to what?
14.
I cannot go over an inch over 14. So, go down in there like that. Whew. Good job. Come on in it. Now, I got to go to 14. I'm nervous. Oh, God, pray for me. These students, I got so many eyes on me, Lord God. Let me find the 14. I could do it. I promise you guys, I could do it. I'm telling you. I'm pretty good at this. Boom! She did it. Now I got 14, right? So I'm going to go ahead and just pull this up like this. As long as I don't click it, then I'm good, right? And then I could actually walk with this like this, but of course I'm not going to be like this, but the needle is protected. You could label it and make sure that you have, you know, the patient's name and what you have in here. It is recommended that when you're drawing up insulin that you get another nurse to verify that. Okay, so please follow your facility policy in regards to that. Test questions might ask you, do you need verification? This is a high alert medicine, and sometimes they may ask you that, and the answer is yes, you need another nurse to verify that. All right, I don't want to hear about what so-and-so nurse do at their job and all that. I'm trying to get you to pass the boards, okay? All right. Now, we got our insulin, and now we're going to go to the patient's room, okay? And what we need for in the patient's room, we need our insulin, we need our alcohol wipe, you need some gloves, okay? And you're going to need your MAR, your medication MAR. So we're going to go into the patient's room, knock on the door, wash our hands, introduce ourselves to the patient. Then we got to identify the patient, ask the patient their name, their full name, their date of birth, and I always ask allergies. So that would be my third identifier. Do not ask the patient, do not identify the patient with their room number or their MRN number, because those things change. Name, date of birth, and do you have any allergies? Okay? So then we're gonna explain what we're gonna do to the patient. I'm in here to give you your insulin injection, and we know we give this sub-Q. So I'm gonna give it directly into your abdomen. Make sure you're like 2 centimeters away from the umbilicus, okay? And when you're giving an insulin injection, you wanna rotate it within the site, okay? So we all know we can give insulin in the abdomen, we can get it in the arms, we can give it in the thighs, behind thighs, and I think right above the buttocks too, if you wanna do all that. So what we mean rotate within the site is, if I'm giving it in the abdomen, I'm gonna give it here this evening, I'll give it here, but I'm still within the abdomen. I'm not going here and then up here, okay? It's just better absorption, right? So the first thing we're gonna do after we washed our hands, we're gonna inspect the skin. Always look at what the skin looks like and document that before you give the insulin, right? So we wanna make sure the skin is nice and dry, right? It's pink. We wanna make sure that there's no bruising. Don't put an injection where there's a bruise or there's redness or there's an open area. Like, no, don't do that, right? So it's nice and the skin is intact. So I like to open up my stuff because I don't like to be, flipping all around with them gloves on. I just don't. Okay, so have that open like that. And be a clean nurse. Don't be no dirty nurse. Have your stuff ready so you can throw it away if you need to. Put your gloves on, like so. My fingers like want to go together. Look at that. When your facility have these cheap gloves like this, you get on a committee. Say, we gonna need something that's gonna work around here. Mm-hmm. It's taking more time. Me putting the gloves on. Look like I don't know what I'm doing. Okay. So what I'm going to do is I found the spot that I'm going to put my insulin in. Okay. Get my alcohol wipe. Pinch the skin. Be nice. Because you pinch it, it helps with, it's not so painful. So you want to rub it in a circular motion outer. Like so. Let that dry. None of this. No, 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 no. Just let it dry. Okay. Then I'm going to get my syringe. Like so. Right? Do not, when you go to inject, do not hold the plunger. No, don't do that. That's a no-no. Because if you do that, you can immaturely leak out the medication and the patient will not get the full dose. Always hold it like this, guys. Hold it on the plunger part, okay? Squeeze. Say I'm about to poke you. Don't lie and say this ain't gonna hurt. Well, if you do it right, it'd be less painful. But I'm about to give you a nice little poke here, Mr. House. Okay, go ahead, girl. Go. Boom. Just like that. Just like a dart. Don't let go of the skin. It's okay. You can still hold on to the skin. Get here to the plunger and slowly inject. Yeah, like that. And then once we're done, we're going to leave it just for a couple seconds and then slowly come out. And anytime you take something that you just put into your patient, always look at that needle. Make sure that needle's intact. You didn't leave anything in there, because that would be bad news brown. But our needle's intact, and I'm going to automatically pull this up like this, and then guess what I'm going to do? Click it. Now that you heard that click, the needle was secure in there and locked, so it will not poke me. And I will put that in my sharps container. So if there's a little, bleeding or anything like that, you can put a 2x2 on here if you want to, or a Band-Aid, but I'm good right here, so there's no bleeding or anything like that. So, and that would be it. So then you would just document. You would document what the site looked like before. You would document in your MAR, of course, how much insulin you gave, what type of insulin you gave, where did you perform the injection, the right upper quadrant of the abdomen, how did the patient tolerate the procedure, and of course you already have your blood glucose already documented. So that is mixing insulin and injection.